Here, so I'm live on the air with Dr. Jersey Sam Rhee from Paramus, New Jersey, and Dr. Texas Sam Jejurikar from Dallas. I'm Sal Pacella from San Diego, and today's topic, we're going to be talking about myths in plastic surgery. So, Jersey Sam, tell us a little bit about what about the topic today. What are your thoughts?
You got it. Before I do that, let me just go into the disclaimer that we always do at the beginning of the show. Thanks, Al. This show is not a substitute for professional medical advice, diagnosis, or treatment. It's only for informational purposes. Treatments and results may vary on your circumstances, situation, and your healthcare provider's medical judgment after discussion. Always seek the advice of your surgeon or qualified healthcare provider with any questions you may have, and never disregard medical advice or delay seeking advice because of something in the show. Thanks. Now, that being said, we are talking about myths and misconceptions today. What is true and false about plastic surgery? So there's a lot of things that people, and I know you guys hear it all the time, stuff that patients will come in and ask you about, things that people ask you, like just in general, like acquaintances. And this is just sort of to talk about what might be commonly be thought of as true, but is actually not in plastic surgery. And I pulled a bunch of things that it's surprising, some of these things that I thought people didn't believe, but I guess still a lot of people do believe out there. So that's something that we'll be talking about today.
Jersey Sam, can we start with a simple myth that we don't have on the list?
Go ahead.
Okay. So what do you mean by plastic surgery? Are you putting plastic inside of me?
Well,
how many have you gotten that one?
I love this one actually, because I think we always sound smart when we explain the answer to people. It comes from the Greek word plastikos, which means to form. So plastic surgery, although it's been practiced for centuries, starting I think with the Chinese, the popular term we use now is plastikos, which comes from Greek, which means to form. And it kind of talks about how plastic surgery got its roots in both reconstructive surgery and initially reconstructive surgery, and then has now evolved to the more popular notion in our society that it's cosmetic surgery. But as we progress in the show, I know Dr. Sam in Jersey is going to spend a little bit more time talking about the difference between cosmetic surgery and plastic surgery. So that's a great opening question, Dr. Pacella.
All righty.
Did someone actually ask you that question, Sal?
Oh, I routinely get that question. Believe it or not,
I've gotten variations of that question a lot too. They don't actually think we're putting plastic, but they're like, "Why do they call you guys plastic surgeons?" I've gotten that at least 10 times.
Right. I have gotten people say because you make people look plastic, so that's why, or plastic appearing, so that's why it's called plastic surgery. And they swore by it. They did say that. That's why.
Right.
And if you know along those lines, anything that's made out of plastic in your life is something that's been formed out of a melted liquid, and so that's where the plastic word comes from. So
yeah. All right. So wait, before I go, how you guys been this week? Anything new? Anything going on in your guys' practices?
Well, this has been an interesting week in the state of Texas, as anyone who has paid even an inkling of time watching the news will know. Coronavirus has really spiked in a few states in the country, Texas being one of them. In this past Thursday, our governor actually instituted a transient ban on elective surgery in hospitals, not in surgery centers, but in hospitals for 4 counties, Dallas County, where I'm located, being one of them. So we're still able to do aesthetic surgery because, as most of our audience knows, we do most of this in ambulatory surgery centers, but the caution level is high. I think we are still very strict about COVID testing everybody and scanning everyone when they come into the building for their temperature, as I know you guys are doing. But I think in general, I'm noticing in our local community there is increasing fear about what could be happening over the ensuing weeks.
What do you do what is your facilities? What do they do with a positive test? Like, how long do they wait? What's their retest policy? Do they have anything specific, or is it different for every institution you're in?
Well, so go ahead.
And I'll be quick so you can jump in. We're basically following the CDC guidelines, where if if someone has a positive test, we wait 2 weeks at the bare minimum. Then they have to have 2 documented negative tests before we would consider doing a procedure on them. Sal, you want to jump in?
Right. So, same criteria. However, we're being a little bit more conservative, and I think I would break that out into urgent surgery versus elective surgery. With elective surgery, if you test positive, we have the luxury of waiting a little bit, letting the disease be treated. If, a fair amount of my practice is reconstructive surgery, breast cancer and skin cancer. And so if someone were to test positive and can't wait for surgery, we have to treat them like a COVID positive patient. So that means we have a special COVID operating room. The entire staff is wearing PPE from head to toe. If they require general anesthesia, there's a certain protocol of who can be in the room at what time during the intubation. So it can be a bit of a challenge. Fortunately, with all the patients that we've tested over the last 3 months, only one has ever tested positive in my practice. And it was for a minor elective thing. She came back and then subsequently tested negative. So,
yeah, we do what you do, Sam. It's positive test means 2 to 3 weeks for us, and then 2 documented negatives after.
Yeah, and I think that the documented negatives, patients really need to know how important that is, because I'm aware of a few patients out there that are still testing positive 4.5 weeks after their first initial test, and it can last for various lengths of time in various patients.
Yeah, it's frustrating.
Yeah, for sure.
All right, so let's jump in here. So who wants to take the first one? I'll let either of you guys take that one. Plastic surgeons and cosmetic surgeons are the same thing.
I guess I'll take that one first. So that is a huge misconception, which I spend still, and it amazes me, much time in my practice explaining to people that oftentimes when they're coming for a second opinion or for revision surgery, that their surgeon actually wasn't a plastic surgeon. And so all 3 of us are board certified plastic surgeons. And what does that mean? It means that we did specific training in plastic and reconstructive surgery. All of us spent, I think, a total of 8 years at the University of Michigan. Is that right, Sal? Were you 7 or 8? You were 8.
8.
Too, right?
8.
So we all spent 8 years, first training in surgery in general, and then with a specific focus on plastic and reconstructive surgery. All of us then did an additional fellowship training afterwards in additional areas within it. So we're highly specialized surgeons who then go through a certification process with the American Board of Plastic Surgery to really focus on the procedures and that we're talking to you about during this show. Cosmetic surgeons are different. I think the reason why cosmetic surgeons have come into existence were some of the economic realities associated with healthcare and the reimbursement associated with cash pay surgery. But cosmetic surgeons have trained in something else. It can be general surgery, it can be oral surgery, it can be family practice. They don't not even necessarily a surgical subspecialty, but they've done some sort of training. It's not. I think some of the fellowships now are as long as a year, but it's usually less than that to get boarded by the American Board of Cosmetic Surgery. But the thing is the American Board of Cosmetic Surgery is not a credentialed organization by the American Board of Medical Specialties. So if you may go to your internal medicine doctor, they're going to be boarded by the American Board of Internal Medicine, which is credentialed by the American Board of Medical Specialties. Same with the American Board of Plastic Surgery. Cosmetic surgery is their own board that these surgeons actually came up with and are not regulated by a larger board. And so it's apples and oranges. I think with plastic surgery, you have an external body that's actually making sure that your doctor has actually done the necessary steps to be qualified to do your procedure. You don't have the same safeguards with cosmetic surgeons.
Right. And, I think the other important thing to understand is not every plastic surgeon does cosmetic surgery, and not every cosmetic surgeon is a plastic surgeon. Okay. To dovetail on what Texas Sam said, we've all been board certified in plastic surgery. We feel very comfortable in and around every part of the body. But in addition, we've all done additional training specifically in cosmetic surgery or cosmetic surgery or surgery in a particular area. Jersey Sam did a specific fellowship in craniofacial surgery. I did a specific fellowship in cosmetic breast and oculoplastic surgery. And Texas Sam did a world-renowned fellowship in cosmetic surgery in New York. So it's important to understand the training that your surgeon had when you pick them for your procedure. You want to understand, are they board certified? Have they done any additional training? As one of our former professors used to tell us, and I'll see if I can get his voice right. When you do plastic surgery, okay, it gives you the license to fix stuff in your discipline. So you shouldn't be doing anything that you can't fix yourself. Okay?
And I would like to dovetail on that because I actually quote him all the time. I cannot do the same kind of imitation that Sal did, but I'm going to try. Being board certified in plastic surgery makes you qualified to make mistakes in plastic surgery.
That was
How'd I
fantastic.
do?
That was really
I
good.
felt like I was feeling it in the moment. I was feeling it.
With all disclosure, that was our former chairman and
Beloved
Professor Dr. Bill Kuzan, who is hilarious guy, and we would be doing the same impression in front of him if he was here signed in. So just
and just to be clear, he's very much alive. I doubt he's watching this, but he is very much alive, and
he is alive. Yes.
and I owe a lot to that man. I probably learned as much about plastic surgery, if not more, from him than anybody else.
Absolutely.
Tremendous surgeon.
Yeah.
Tremendous surgeon. Hilarious.
Yes.
Yeah.
All right. Well spoken. Well said.
Okay.
Okay. All right. Let's go to the next one. Plastic surgery is only if you are vain or have poor self-esteem.
All right, so I'll jump in and take this one. So plastic surgery is only if you're vain. So that's blatantly false. So any patient that comes in for an evaluation, one of the things we want to do as surgeons is we want to tease out the reasons for having surgery. And a question I always ask patients is, you have to ask yourself the question, is this deformity or this issue with my body affecting my quality of life? And I throw this scenario out there. I say, when you wake up in the morning and you look in the mirror and you look at your face or your breasts or your abdomen, and if it's something that you look at and you just can't say, oh God, I can't stand this about myself, that's a very good reason to do surgery. If you look in the mirror and you look at that issue you have and you say, I wish I was better, but, I'll live with it, then that's not a really good reason to do plastic surgery. Plastic surgery is to correct deformities of form or function in the body that essentially the patient is unhappy with. So to give you an example, myself, I've had plastic surgery. I used to play rugby in college and into medical school and in residency. And, I got hit in the head a couple times. That explains a lot. Okay, Sam. Both Sams. And, my nose was broken several times. And I had some real bad difficulty breathing. And, my nose was a little bit crooked, but not too bad. And so one issue I had was just breathing. I'd have issues at night. I'd snore. It'd be very problematic. And so quite a number of years ago, I had my septum realigned, and I had some turbinates on the inside of my nose removed to help with my breathing. He also kind of broke my nose and set it back in a position, and it's perfect now. But that was it wasn't for appearance. It was simply for for breathing, but I got a little bit of benefit of appearance. So that's a perfect example, I think.
Yeah, I think we would all agree that we do have some patients that are vain and have poor self-esteem, and they make the worst patients. If vanity is the reason why you're there, you're never going to stop being vain, and plastic surgery isn't going to fix that. If you have poor self-esteem, it's important to work on correcting that first before you would get plastic surgery. I think the patients that do the best are patients that are active, that are fit, that are healthy, that work out and they have problem areas that they can't fix, or that they take really good care of themselves, but they see signs of aging that they can't correct. Much like Sal, I too have had plastic surgery. Mine was strictly for aesthetics. My weight vacillates like most Americans, but after working out during a period in my life where I was working out a lot, there was areas of fat that I couldn't get rid of on my abdomen and my flanks. So I had liposuction, and I wasn't doing it to fix morbid obesity, though I have since evolved into that, but we'll talk about that later. At the time of my life, I wasn't doing it for that. But I was doing it to correct areas that I just couldn't fix through diet and exercise. And the benefits to me were huge. I still love the results of that surgery, and that was 15 years ago. I think, plastic surgery is there to help fix problem areas. It's there to correct signs of aging or things that are just, you can't stop. It's not there to fix intrinsic problems within someone.
Right. I think part and parcel to that is, part of our evaluation for patients in the office prior to surgery is to really understand and manage the expectation of what they're trying to get out of surgery. That just goes back to the doctor-patient relationship. We spend a significant amount of time screening patients for surgery, discussing what the expectation is after surgery, and we document this. And that's important for patients out there, or potential patients. When you go into a facility and you meet a coordinator or some marketing person to sign you up for surgery, and then the first time you meet the surgeon is 5 minutes before the operation, that's not a good thing. You're not really understanding or getting the ability to understand the entire process.
I didn't know this was going to be a confessional about whether I've had plastic surgery or not. But
first off, Jersey Sam, you gotta qualify this a little bit. So Jersey Sam's into CrossFit. So why don't you just show everybody your
Exactly. Exactly.
That's all hard work. That's not plastic surgery, buddy.
Right.
Right. No. I've never. Not that I wouldn't, but I haven't had anything for myself other than the only time I've undergone anesthesia was for a colonoscopy last year. I don't know if that counts, but
well, I'm sure your colon is much prettier as a result. Exactly.
It was great. So
exactly. Your wife has been raving about it, actually.
No, she
TMI.
Exactly. Sorry, crossed the line. That was bound to happen at some point.
For those on the audio podcast, I don't know exactly what to say there. So, but I have to agree with both these guys. A patient should really know very specifically why they're coming in to see you and why they want something addressed. And if they do that, and as a plastic surgeon, you can address that, you're in a good spot. That's really good.
Right. And our society is changing. In the 70s, 80s, it was a little bit taboo to have plastic surgery. Now it's, 2020, where it's generally accepted.
Absolutely. I think that it's different now than it used to be. All right. Next one. Plastic surgery is expensive and not affordable.
True. All right, next question. Plastic surgery is not cheap, but plastic surgery is not for the very wealthy. I think, the thing that makes plastic surgery daunting to a lot of people is, unlike other medical procedures that they might potentially get, this is something that they pay for out of pocket. But I think when you go in and you see someone, you understand that There's financing options that are available. There's an ability to take an expense that seems daunting and actually make it quite manageable. So many of my patients are from relatively modest means. They're not, they're not selling their house to have plastic surgery. They're budgeting for it and they're able to afford it.
Yeah, I have a little saying I tell patients when they say, many people before they look at the quote or see the cost, they say, well, it's just, I don't know if I can do this. I feel like it's going to be very expensive. And I say, it's not as expensive as a Prius, but it'll last you a lot longer. So, now, can you guys hear me?
Yeah.
Oh, okay. So, I think it's important to understand what the, as a breakdown for our listeners, what the costs associated with plastic surgery actually go to. So in general, there are several fixed and variable costs that we need to charge patients in order to do their surgery. So the first cost, which is usually the biggest cost, is what we like to call the professional fee or the surgeon's fee. And, that pays for, the surgeon's time, the surgeon's overhead, the office expense, etc. There's also a charge for the anesthesia component. So that goes specifically to the anesthesiology team to cover their costs. There's a third cost associated with plastic surgery, and that involves the facility that you're in. So for any particular facility, there's some rental fees, if you will. So, an hour of surgery costs a bit less than 5 hours of surgery. And so that's going to be some cost. And then finally, the last cost, which is variable depending on the surgery, is whether or not we use any product or implant within the surgery. So, for example, if you're doing a facial surgery where there may not be an implant component, that there won't be any cost for an implant. If you're doing a big, large breast surgery where you need several implants or some tissue that's out there to support the breast, that may come with some additional cost.
I think the other thing that I think I have seen patients do is look for relatively cheap plastic surgery. So a lot of people will travel to certain locations, like Florida is very popular, or overseas, say the Dominican Republic or South America or Latin America, to get their surgery. And while the overall price is lower, the overall, not to sound like a naysayer, but I've seen a lot of patients who end up spending a lot more than they expected to because of complications, because of other issues. And I would say if it's only expensive and not affordable if it's something that you don't want to have done. If you really care about your body, or your face, you really want something that's important to you, like Sal said, it's going to last you a lot longer than a Prius. It's a big, quality of life improvement, and it's worth finding the right person. Like Sam said, there are financing options available. You don't have to bankrupt yourself to make yourself basically happy. So.
Yeah, and just to dovetail on what Sam said, finding a surgeon that is invested in your outcome cannot be overstated how important that is. There are places that you can go to where your surgery will basically be done in bulk, basically going to the Costco equivalent of having surgery done, where they're doing a high volume. That may be overseas, or that may be in certain regions of the country. And ultimately, you'll find that when you return to your community, you're going to have a hard time finding a plastic surgeon to take care of you should you have a problem. I wish complications never happened in surgery, but as these guys will testify, they happen. Sometimes they do. And the key is to not get some sort of guarantee that you won't get a complication, but it's to find someone that's invested in your care so that if you have a problem, they are there to take care of you and they will walk with you to the finish line. And that's a very hard thing to do if you do go to a place where you're simply price shopping and willing to travel large distances to do it.
Yeah, and oftentimes when you go back to your community a few days later after surgery, you're essentially off the reservation. You're out by yourself.
It's very true. Good points. All right, let's go into some specifics. Liposuction is an easy and good way to lose weight.
Liposuction is not a weight loss surgery. Liposuction If you are morbidly obese and you have liposuction, you will be morbidly obese at the end of the procedure. Liposuction is great for people that are relatively close to their stable weight as a way of shaping their body. If you need to lose large amounts of weight, the key is to figure out ways to lose that weight prior to having a surgical procedure. And that may be surgical or non-surgical, maybe bariatric surgery, maybe diet and exercise. But invariably, when I have obese patients who are coming in for liposuction, I stress to them that disappointment is invariably going to be their outcome from a large liposuction procedure. Now, many of them will sometimes say that they still want to get the procedure done as sort of a jump start to a weight loss regimen. And I don't entirely disagree with that, to be honest with you. I've gotten some very happy patients doing it that way. But we realize that's the beginning part of a long journey to get to where they want to be.
Yeah. I would say I see this more than anything else, probably, in terms of my patient candidates. I tell them, if you haven't figured out how to manage your weight and to be happy before your surgery, it's going to be really hard to figure it out afterwards. And I see a lot of patients with good intentions, and Sam's right. I've seen some very, very positive outcomes, but it's hard to get healthy. And liposuction alone is never going to be the answer. And I will often sort of caveat the surgery. And I always say, I say this to a lot of patients. I'm like, listen, you talk to me long enough, I will take your money and do the surgery. I'm a surgeon. That's what I do. But I've done this a lot of times, like thousands of times. And I know what it's going to take to make you happy, and what it's going to take is not just liposuction alone. And so let's figure out how to do that to make sure that you have a good outcome.
Right. So, one comment I have is I think we have to understand when we do liposuction, how we do it. And this may explain this fallacy a bit here. So when we do liposuction, we inject a volume of fluid with anesthetic and epinephrine in order to stop or to control some bleeding or bruising. And then we subsequently remove that fat with remove that solution in a small cannula. Now, if we're talking about removing pure fat, let's say we have a liter of fat, how much do you think that weighs? Well, so okay, I won't answer you guys. So many people will think that liter of fat, well, that weighs a lot. That's going to translate into me losing 10 pounds. That's actually not true. The reason being is fat is a very low density molecule in the body. And so 1 liter of fat, I had to look this up on Google, actually. I'm not that smart. 1 liter of fat weighs only 1.98 pounds. So if you did 3 liters of pure fat liposuction, that translates into only simply losing 6 pounds. And that's not a ton. The other myth that sort of goes along with this is I commonly get the question. I've heard that if you do liposuction, all that fat goes into a different area if you gain weight. Jersey Sam, what are your thoughts on that?
Ooh, that's another myth coming up.
Yeah.
Is it? Oh,
yeah,
we're going to have that on the list?
Yeah.
Oh, my mistake. Sorry.
No. Well, we can just jump ahead to that. We'll skip it when we get to it.
All right. Perfect.
All right. Good points. All right, let's maybe that's the next one. Let me see here. Oh no, yeah. All right, so you don't need liposuction or body contouring as long as you exercise and eat right. And I know Sam sort of touched on this before.
Right. Yeah, I think we've already sort of touched on this. I won't dwell on it. Basically, it's not a substitution to diet and exercise. Diet and exercise gets you as good as you can possibly be on your own, but for the majority of us, it's not quite good enough. That's where liposuction or body contouring procedures will come in. If you've had children and you have muscle separation, you can't exercise your muscles back together. You can only make them stronger, but you can't give yourself a flat tummy, and that's when you might need a tummy tuck. If you have problem love handles, no matter how much you work out, liposuction is going to be a benefit to you.
Right. I get this usually from partners of people who are planning on getting liposuction is you're not eating right or you're not exercising, so you shouldn't really do this. I mean, enough. And I think that's the key. I think the happiest patients are the ones who are doing all the right things in their lives, and they just need those stubborn areas genetically that a lot of us have that just need treatment. And I think that works well. All right, let's move on. Here you go, Sal. Fat will reappear in other areas after liposuction. So as Sal touched on here, when you do liposuction, you are actually removing fat cells. However, you're not removing every single fat cell in the body. There are fat cells left in the area that was liposuctioned, and there's fat cells left everywhere else. Ideally, patients are not gaining weight or becoming less fit after liposuction. But if they do, they will get fat in all areas, including the areas that were liposuctioned and areas that were not. Sometimes because of the fact that, let's say you had your abdomen or your belly liposuctioned, it looks better. So maybe when you gain weight, other areas may look like they're gaining more fat, but you're really gaining fat everywhere if you get fat again after liposuction.
Yeah, I completely agree with that. If you stay at a constant weight, fat will not reappear. If you gain weight, no big surprise, you will get fat. That's just one of those invariable truths of the human existence. You can't magically gain weight and not get fat.
All right, let's move on. I get this one a lot. It is better to gain weight before a BBL or Brazilian butt lift.
Yeah, Brazilian butt lifts are still a very large portion of my practice, and I don't get this procedure as much as I used to. I feel like patients are getting a little bit more educated about this, but fat is not a constant thing in our lives. Fat swells when you gain weight. Fat shrinks when you lose weight. So if you gain weight for a Brazilian butt lift simply to make it easier for your surgeon to have more fat to transfer, you better be prepared to stay at that weight after surgery. If you're not comfortable staying at that weight, when you lose weight after surgery, your butt will shrink. So only if you truly want to gain weight, which very few men and women want to do, is it a good idea to gain weight before a Brazilian butt lift?
I think I get a lot of this because patients like letting themselves go. It's basically a hall pass to get fat or fatter, or not to work out, or just to eat whatever they want. And it's very rare that I will have a patient where I am worried about the fat content of their body, where I'm saying, I don't know if I can get enough fat from your body from liposuction to transfer into your butt. That, I would say, is a very, very, very few patients are that way. I'm more likely to get someone who's, say, 5'1" and 210 pounds gain an extra 10 or 15 pounds because that person thought I needed to give them more fat, which is not true.
Nice dramatic pause there, Dr.
I think now I forgot what I was going to say. Sam was right. You need to be at your happy weight. That was what I was going to say. Yeah. Be at your happy weight before you get to your procedure. Don't sit there and try to gain 10 or also lose 15 or 20 through some sort of starvation diet before your procedure. Get to where you can sustain and maintain for a long period of time.
Right. BBLs in general are not a huge, very popular procedure out here. But I think, on this question, what the patients and listeners really want to understand is, as Texas Sam pointed out, is your weight will fluctuate. So if you end up gaining weight before a procedure with the intention of keeping what you have and then subsequently lose weight, your surgeon was sculpting the buttocks based on what that current weight was on the day of surgery. Now, when you lose weight, to be honest with you, it's a little unpredictable on how things are going to look after you lose that weight again. And that's based on the technique that's utilized. It's based on the location of fat. It's based on a lot of separate things. So this is a little bit of a slippery slope for patients, I think.
Yeah. I completely agree with all that you gentlemen have said. There's a lot of regional variations in terms of what people are looking for and ethnic variations. I think there's a huge diversity of what my results look like depending on patient wants. But I will say the one thing that is always true is when patients come in and they say, I'm not sure if you can find enough fat on me. And I tell them, oh no, you've got plenty of fat to use. They're always disappointed. And that's a hard conversation to have with them. Like, actually, you've got plenty to get the results you want. But gaining weight to have a BBL never leads to good things.
Agreed. All right. It is unsafe to breastfeed after breast augmentation.
You want to go with that, Sal?
Yeah, sure. Again, I think that's a fallacy. There are many, many women with breast implants in the world, and many of them have sustained enough food or many of them have produced enough milk to sustain an infant. So that's just simply not true. And I think if you look at where the implant is placed anatomically, most of us place implants below the muscle, and I think 100% of us placed implants below the breast. So it's not at really no time is an implant inside the breast. It's usually behind the breast. So that just simply doesn't exist. I mean, there's no documented evidence that silicone will leak out of the breast implant into your breast and into your baby. So I think that's a true fallacy.
I really have nothing to add to that. I completely echo Dr. Pacella's sentiments.
Yeah, and they've done studies where they've measured breast milk, and there's not any level even close to affecting an infant or by breastfeeding with a patient who has breast implants in place. So.
Right.
This is a big one. Breast implants need to be changed out every 10 years.
So I think that was a myth that was started by the implant companies and surgeons so that they could get patients coming back every 10 years.
Conspiracy.
Yeah, I mean that was actually common teaching, I think, when we were residents and fellows, but that's just simply not true anymore. We're now on the 7th and 8th generation of silicone out there. It's exceptionally hardy. It's a cohesive gel implant. Most of the implants we use are cohesive gel, meaning they are more semi-solid implants. They have an exceptionally low rupture rate. And what I tell patients commonly is every year that you have your implants in, the chances of something going wrong with them probably go up. But that doesn't mean at 10 years you have to rush in and change them out. If it's not broken, there's no need to fix it.
Right. Yeah, I completely agree. I'll tell patients, you're not a car. You don't need to come in for regular maintenance for your implants. However, just like Dr. Pacella said, there is a finite lifetime to an implant. But with these most recent generation of silicone implants, that period of time has been extended out. So what are the things that might make someone come in? Well, still the most common complication we'll see is something called capsular contracture, which is basically pathologic scar tissue buildup around an implant, sometimes thought to be due to a low-grade infection. So if you start to notice hardness or pain in the breast, that would be a reason to go in and potentially talk to a surgeon. If you're unhappy with the size, or if they've begun to droop, or you just simply don't like them for aesthetic reasons. And then the whole notion of breast implant illness is a very controversial topic, which I don't think we necessarily want to get into here, but if you do think you are having generalized symptoms from your implants, fatigue, food allergies, rheumatologic symptoms of some kind, it's worth at least having a conversation with a plastic surgeon about that as well.
I think there's some misconception because I think the most warranties for most companies, it's a 10-year warranty, which is why people think that. But as Sal said, if you're not having an issue, there's no reason to do anything with them.
I've got a question for both of you. What, in your practice, what has been the longest time you've ever seen an implant in place? For a patient?
Greater than 40 years.
I was going to say 30 plus, but it was hell taking it out. I'll tell you that right now. When I took it out, it was bad. It was the longest was like a some sort of weird polyurethane shell silicone thing that exploded. It looked like it was an explosion inside the breast, and it was just all capsule and like clear yucky motor oil that I had to, like, it was a mess when I had to take that thing out.
I mean, I was going to say, this being Texas, we're coming across a lot of patients now who've got implants put in the late 70s, early 80s, who want to have something done, and they're hard and exploded, and oftentimes you can't even see the implant shell when you go back in there. Like, you can't even find it. It's just this amorphous, massive goo, calcifications or hard areas, and this thick scar capsule.
For 45 years, I had a patient that had implants, and they were, to be honest with you, just as soft and supple as probably the day they went in. So it was pretty impressive for me. We didn't actually choose to do surgery on her. So,
oh, nice, very nice.
Yeah. Oh, nice. All right. Next one is Botox is dangerous because it is a poison.
It's dangerous because it's addictive and it costs money. But it's definitely not poison.
Yes, completely. Botox is dangerous because once you have it, you just can't stop.
That is true.
Yeah.
Yes. So it is a poison. It is purified botulinum toxin, which is a muscle paralytic. At the doses that we use it at, it is not dangerous at all. And in fact, Botox for a long time was used in children for strabismus correction and other eye muscle type of procedures. And so it's had a really, really long track record, decades and decades and decades. And, studies have shown repeatedly that it is safe. It is complications from the actual treatment with Botox is extremely rare, and it's probably one of the safest treatments that we actually have out there.
Yeah, just out of curiosity, do people actually think it's dangerous in your practice? Like, is that a thing?
Again, I think there are people who don't want others to get Botox, so they put the scare in them, like, partners and other people, and so then they come in with these things like, so and so told me I shouldn't get it because it's dangerous, and then but usually they have some sort of bias against Botox, like they don't want that person to pay for it or something.
Because the trend in my practice, and tell me if you guys have seen this, is over the years, my patients have become increasingly younger who are getting Botox. Probably 35–40% of my Botox patients are in their 20s and 30s now. I just sort of assumed there was more generalized acceptance of it. But I guess I'm geographically in a place that maybe it's just not even a thing.
No, I think that's true. It's very true.
I'm still seeing 30s, probably anyone who's had a kid. Like, it's not that common for me to have Botox patients that have not had children. Let's just put it that way. Like, most of the Botox patients I've seen are dads and moms. 20s, I'll see fillers for sure, like a lot of filler patients that young, but maybe it's just like you said, my demographics probably.
Interesting. Okay.
Yeah, here you go. Once you start getting Botox, you'll have to keep getting Botox or your face will look worse than before.
I think I would get rid of that phrase "than before." The way it looks worse. But no, Botox doesn't somehow accelerate the aging process. It's just when it wears off, you have wrinkles again that were the same reason why you were prompted to get it in the first place. But what I will say, and I'm sure you guys would echo this, when patients get regular Botox and there's this sort of prolonged lack of signal to the muscle, or denervation is the medical term, I think they can go longer and longer periods of time before the wrinkles start to come back. I find that many of my patients just hate motion in general, so they still come back on a regular schedule to get their Botox. But for patients that are simply just trying to avoid wrinkles, I think once you start, generally if it's a couple of years that you've been doing it every 3 or 4 months, I find that patients can space it out and their face still looks great if they wait, 5 or 6 months between treatments.
Right. And I think another way of saying that is, as you get Botox and the muscle becomes deconditioned, that will change the appearance of the muscle going forward. And we can actually use that to our advantage. if you've got a really thick muscle right here, many men have this thick muscle right here called the procerus and corrugator here. And if you hit that with Botox, after a couple of years, that will soften. Your forehead will look less projected. Another common place to do Botox is right here along the jawline and something called the masseter muscle. If you're a tooth grinder at night, you grind your teeth, and these muscles can be very big and thick. Oftentimes, hitting this with a little strategic Botox after a year or two will thin the face out and have a better profile. So we can use that to our advantage cosmetically.
I think I wonder if there's some feedback mechanism too. Like if your body knows that muscle isn't responding when you express and when you emote, maybe you also subconsciously just stop using those muscles as much when you're talking, and maybe not right away, but after 3-4 years, you're just not really firing those neurons the way you normally would, and so you get less of that sort of contraction. I don't know.
Right. I think the feedback mechanism occurs with a lot of patients in San Diego because I think they wake up 3 months later and look at their watch and say, ding, 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 today's the day. Mm-hmm. It's been 3 months.
Exactly.
Some of my most loyal, like clockwork patients are my Botox patients. They just can't live without it. It's really.
Yeah.
All right. Injectable fillers will stretch out my face or deflate my face.
I mean, I don't think this is 100% a myth because I have run across patients that do too much. I think the majority of patients, though, this is not true. I think if you do periodic injections, usually in our practice, it's somewhere between 4 to 6 syringes in a year. I think that's something where you can maintain a youthful appearance around the mouth. You can maintain some volume in the lips, a little bit of volume to the cheeks, help with tear troughs or the dark circles along the inner portion of the eyes. If you do that sort of every year, no, you'll just sort of maintain a relatively constant appearance, and I think actually slow down the aging process. However, I don't know, and I'd be interested to get your guys' comments on this. I'll find patients that love the way that they're looking with their fillers, so they'll want to do more, just some sort of preventative measure, and they'll want to get more. And then they can look cheeky, or their eyes look really closed because their cheeks are so. I mean, you can make people definitely look bad if you overdo fillers. But if you're smart about it, no, I think it just delays the aging process rather than worsen your appearance.
Yeah, I agree with that. I think if you are using it to restore, it's one thing. But if you're using it to actually change your facial profile in some way, like a significant augmentation over time, I think that is a problem.
Right. I'm a firm believer in less is more. My aesthetic, I think, is very conservative. I trained in the Midwest. I trained in the South. Patients that come in and they want, multiple syringes in an episode. I'm not simply the guy for them. The reason being is that to me, it's a lot about the location and the placement of the filler than it is to the volume. I can get by with 1 and 1.5 syringes giving to the lips at any given time with little left over to the side of the mouth. Some patients come in, they want 3, 4, 5 syringes in the lips, and it's just simply not feasible. It's just not going to look right. I tell them, if you're looking for that kind of look, you got to drive up to Beverly Hills about an hour north.
Yeah, that's not my aesthetic either. There's definitely providers for those patients. I think most of us are probably, most of my patients, and I know the same is true for yours as well, tend to be wanting to look natural or natural-ish, as one might put it, not look overtly fake. And when you start putting ridiculous amounts of filler, you cease to look human. You look like a youthful alien.
Right.
Like this?
Right, exactly.
Right, just like that.
Just like that.
5 syringes. Wow. All right. Botox and fillers are not worth it because you have to keep getting treatments.
I mean, I guess you can make the same arguments for getting your hair dyed, your hair cut, your nails done, in Sal's case, his back waxed.
But, it's like a baby. Look at this. This is a baby's bottom right here. It's a baby's bottom.
But Botox and filler are things that we do to improve our appearance, but they are an investment in your appearance. So
you could take your sweater off.
Yeah. So I think I think it's you need to do maintenance. People come in and they say, I don't want to keep coming back. Well, we don't have anything better than that right now, and it works really, really well. So everything in life is a cost benefit analysis. For most patients, the benefits are worth the regular cost involved with it.
Yeah, I think for the people who do it, they realize just what a difference it makes overall. I mean, it's subtle, but it's powerful, and you're right. It's a built-in cost, just like, I mean, listen, some of these skin creams that I've seen people use, it's insanely expensive. It's more expensive than gold by the ounce, for God's sake. So if you think about it as a cosmetic expense, like you said, like nails or hair or something, that's really the right mindset.
Yeah. Right. I mean, and to keep things in perspective, there's a tremendous amount that anybody could buy with disposable income, and this just fits into the bucket. You want to buy a nice bag, you want to buy a nice piece of luggage. This is part of your imagery. If that's not important to you, then there's no need for it. But if it is, then certainly there's no criticism on spending your money however you want to.
Facial procedures look unnatural or artificial?
I'll take that one on first. I think there probably is a little bit of truth to that, but I think it depends on the procedure and how it's performed and when it's performed within your lifetime. For example, let's go back to the eyes. There is certainly a way for eye surgery to look unnatural. And it is not our goal as plastic surgeons to make people look unnatural. And I think, to me, this occurs mostly in when we try to take procedures designed for females and apply them to men. We sort of hinted at this in last week's podcast. Men need to be approached with a different aesthetic than women do. So you can't take the same eyelid procedure and apply it to men that you do to women. And I think, again, at the end of the day, you have to look at the surgeon's aesthetic. So what I would counsel patients that are listening listening to the podcast here is, you really want to look at a surgeon's before and after pictures to see whether or not that particular type of surgery fits into what you're looking for. And if you see that after looking at 10, 20 photos that each of these patients look the same, they look dramatically different, and you don't like their appearance, then that's probably not a surgeon that you want to have perform surgery on you. If you like their appearance, or if you see, that the result is natural, then that's somebody you may want to invest your time with.
What about these celebrity photos of these well-known people who've had facelifts? Or, I mean, the ones that come to mind mostly are men like Kenny Rogers or Burt Reynolds or Mickey Rourke. But it sort of puts a bad taste in my mouth when I see these examples of what people think plastic surgery for the face is.
Right. No, I agree completely. And I think that's a perfect example of applying a procedure that's designed to look good in women to men. And I think that comes out looking very unnatural.
I couldn't agree more. I think male aesthetics is just such a different animal that plastic surgery done poorly can definitely look unnatural and artificial. You need to make sure the surgeon, just like Sal said, actually respects the aesthetic that you're going for. And I think even in women, plastic surgery can at least transiently look unnatural and artificial for a period of time after surgery. If I'm doing a whole facial rejuvenation on someone, I generally tell them it's going to be about 6 months till after surgery before their face really softens and they really are in love with the way things look. And that's just the nature of things. There's to get curves and a softened appearance of the face just takes time and a little bit of gravity after surgery. But it, in general, I think facial procedures look quite good, and people, for the most part, look much better afterwards.
Right. And, another thing I've noticed throughout the years is some of this appearance of looking unnatural is very much a keeping up with the Joneses type of phenomenon. If you look at it, an example is, the Louis Vuitton bag. Okay. That's a status symbol in our society. It's an expensive bag, but quite simply, it's a brown leather bag that there's no variability to it necessarily. It's just one type of appearance, right? It's a brown bag with a logo on it. And so I think, my theory is that years ago, a very affluent person went to a plastic surgeon and came out with massive cheeks and big lips, and people looked upon that person and said, wow, she is really well off and she can afford this look. I want to look like her. And that's just like having the Louis Vuitton bag.
Oh yeah, that phenomena is definitely true in plastic surgery. I mean, during my fellowship in New York, there was a very prominent a plastic surgeon for facelifts who had a very, very distinctive look to his patients, and being able to get his facelift was a status symbol. He was expensive. He did a high volume of them. People knew when someone had that particular look. And the same was true with rhinoplasty. In the 1980s, there was a really famous plastic surgeon in New York City, Howard Diamond. The big thing in New York City was the diamond nose, where there was a very particular look to the tip. Plastic surgeon in affluent societies can have a very signature look depending on the surgeon, and it is a sign of status, much like a Louis Vuitton bag.
Agreed.
Yeah.
Plastic surgery procedures are addictive, and once you start, you keep going with them.
This is a myth, or is this true false? I'm going to let Sal take this one. I mean, generally people like plastic surgery, right? Nice things in life when you spend your money on something and you feel like you get good value for it and you enjoy it.
I thought you were going to let me take that one, and then you just kept talking.
All right.
Go ahead.
No, I do think there is an addictive nature to it, not because we develop a real physiologic addiction, but because people like it. I'll leave it at that.
Yeah, I don't think it's so much an addiction as an acceptance. I mean, addiction to me, it implies that, that takes priority over everything in life. And, you can't do your normal activities in life because of the addiction, like alcoholism or drugs or whatever. And I don't think that's simply true. I mean, there's an overall general acceptance. Somebody who is undergoing a breast revision surgery is probably more amenable to surgery than someone who's getting a first-time breast augmentation simply because they've been through it before. Botox is an example of that. Once you get it, you sort of know the process. So I think it's a comfortability of understanding what the process is. Now, that being said, I think one of our skills as board-certified plastic surgeons is psychology. We have been talking to people for many, many years to tease out their intentions and their expectations of surgery. And I think at this point in my career, I think I'm very attuned to understanding when people may have unrealistic expectations. And that's where I think the addiction comes from.
I mean, there is a known psychiatric disorder, body dysmorphic disorder, BDD. And that is part of what we look for in patients. These are patients who have issues, which sort of make them seek repeatedly to have multiple plastic surgeries. It is a known psychologic disorder. Barring that, which is pretty unusual and rare, I think I would say more that plastic surgery procedures are progressive. So I will certainly see patients for Botox and fillers. And then at some point, over the years, they might get a neck lift, or they might get a lower lid bleph, or they might have something else because what the treatments they were getting were not sufficient as they get older. I don't think that it's less common for me, at least, to see patients who say get a nose job and then they get a a breast augmentation, and then they get a BBL, and then they get, you know, where they're just totally remaking every part of their body. I think that's certainly less common in my practice. I'll usually see patients who have issues about a particular thing that they want to either maintain and dress or improve in a different way. But I think you're right. I think once you realize what plastic surgery is all about, what it can do for you, it's a pretty powerful tool. And if you see something that is of issue, applying that tool becomes more straightforward for some patients.
Samir, plastic surgery can be an addiction. Hello.
I don't actually remember that, but I can.
I don't think he ever said that.
But I can picture that.
I just thought his voice would go perfect. Right
Yeah, you know, I would slightly challenge what you're saying there, Sam. I think it's really common in my practice, and I bet it's even more common in your own practice than you realize, that people will actually come for different procedures in different parts of the body. You know, think about your own experiences for services that you get. You find someone that you like who, you know, who's your dentist, or you find someone you like who cuts your hair, and you have a good experience. You have a pleasant experience. You like dealing with the people in that office. You like being in that office. You like going there. You know, you don't have body dysmorphic disorder just because you like fixing things on the human body. The human condition is that, in general, when we fix one problem in our life, we just move on to the next problem. Almost nobody I know is totally content and just says, I'm good. Like that's all there is to it. And so it is really common in my practice to see people who I will do their breast augmentation on, and then I'll do their liposuction and their BBL, and then I'll do their rhinoplasty, and then years down. I mean, I think it's actually more common in your practice than you would actually think on first glance too. People like when they form a bond with you and they trust you and they know that you're going to care for them, that you're invested in them. They will trust you to take care of other things too.
Texas Sam, that's sort of the same way you feel about getting your mani-pedis, right? How often do you?
Well, coronavirus has changed that a little bit. But what's wrong with that, dude? Sorry, I like having soft and supple hands. Is that a problem?
I clearly need to treat myself more.
Yes, you do.
You need to pamper yourself, love yourself a little bit more. Sam.
Seriously.
Val, sorry.
All right, that was the last one. So is there any other myths or misconceptions that we haven't covered yet?
I think the last one is that Bill Kuzan actually does have a lower, softer way of speaking. I just think we need to put that out there as well. He doesn't always howl. I've actually had many conversations where he sounded not like a grizzly bear. So that's really the last one that's out there.
You know, I just saw him last year, and he sounds exactly like that. I mean, he just goes, well, yeah.
He's a very, very passionate guy. You have to understand, he's a very passionate guy.
Yeah. I hope he sees this.
I'll make sure of it.
All right.
In fact, what we're gonna do is we're gonna edit a clip here, and we're gonna send it to him to put it into a conference at the University of Michigan. That's what.
Absolutely. I'm gonna chop it up. I'm gonna send it. Hell, we're gonna post it on YouTube too, so everyone can enjoy it.
I don't really sound like that, okay?
He's like he doesn't even have a chance. He's not even allowed to say anything. It's like shooting fish in a barrel.
Oh, that's right. Again, full disclaimer. I think we all learned a tremendous amount of plastic.
Absolutely.
We all truly love him, and like I said, we wouldn't be teasing him. We would be teasing him the same way if he was on as a guest. In fact, I think we're going to invite him as a guest at some point.
I think he needs to be the next guest we have on the podcast.
I think that would be awesome. All right. Well, it's an hour 3. That was great. I think this was our best one yet for sure. I really appreciate Sal Pacella, Dr. Sam Jejurikar, and I'm Sam Rhee for 3 Plastic Surgeons and a Microphone. And hope you guys have a great day. All right.
Peace out.